Many nurses don't leave the profession because they hate nursing. They leave because they're tired, physically tired, emotionally drained, and psychologically overstretched. Studies show that more than 62% of nurses over age 40 experience chronic burnout symptoms, not because they lack passion, but because the modern healthcare system demands more than the human body can consistently give. But what if I told you that you can still use your nursing knowledge, still make an impact, and earn more money with less stress outside the traditional hospital bedside? Today, I'll walk you through 5 low-stress healthcare careers that nurses can transition into roles that protect your mental health, honor your experience, and significantly increase your earning potential. Before we dive into the career options, let's quickly acknowledge the reality many nurses face, especially nurses over 40. Psychology research shows that chronic workplace stress leads to decreased cognitive processing, lower emotional resilience, muscle and joint fatigue, sleep disruption, compassion fatigue, and even a loss of personal identity. The truth is simple: your clinical skills aren't the problem. The environment is. This is why stepping into low-stress, high-impact roles is not running away, it's protecting your longevity. Now let's explore the 5 best career paths where your knowledge is valued, your mental health is protected, and your earning potential increases. Clinical informatics is one of the fastest-growing fields in healthcare. These are the people who work behind the scenes to improve electronic health records, streamline workflow systems, and reduce documentation errors for facilities. Think of it like this. You take your nursing knowledge, combine it with some basic tech training, and suddenly you're in a role where the stress level is very low. There are no night shifts, no patient lifting, and no code blue adrenaline rushes. It's mostly remote or office-based, offering a focused and calm work environment. The salary potential is also impressive, ranging from $85,000 to over $140,000 a year. It's a high-value skill in high demand. This path is perfect for nurses over 40 because it uses your clinical judgment but protects your body. It appeals to problem solvers and offers better psychological stability with predictable routines. You don't need a whole new degree. Training is often available through short certifications. With hospitals going fully digital, nurses who understand technology are becoming absolutely essential. Informatics isn't the future, it's happening right now. Next up, if you enjoy teaching, mentoring, or guiding younger nurses, then becoming a nurse educator may be one of the most fulfilling transitions you can make. And I'm not just talking about full-time university jobs. Today, nurses are earning excellent incomes through online tutoring, hybrid nurse education programs, teaching in skills labs, private nursing coaching, and even creating their own continuing education course content. The stress level is low, with a flexible schedule and the ability to work from home. You get to have meaningful interactions, not just rushed tasks. The salary potential ranges from $70,000 to over $110,000, with plenty of opportunities for additional income from courses, consulting, or tutoring. The psychological benefits are huge. This role offers higher emotional fulfillment and allows you to make a direct impact without the burnout, all while reinforcing your professional identity. For nurses 40 and above, this role really taps into your years of experience, your wisdom, and your calmness, something younger nurses often desperately need. Now, for those of you who enjoy research or explaining medical topics, our third option is medical writing or editing. Healthcare organizations, pharmaceutical companies, and medical brands are constantly searching for writers who understand accurate medical information. You could be writing patient education materials, nursing guides, medical blogs, health articles, continuing education materials, or even pharmaceutical documentation. The stress level here is extremely low. There's no physical work, no emergencies, and no shift work. It's a role you can typically do from home, giving you a controlled workload. As for salary, freelance medical writers can earn anywhere from $40 to $120 per hour. Full-time positions often range from $75,000 to over $130,000 a year. The psychological benefits include deep focus work, intellectual stimulation, and a great sense of control over your day. Nurses are naturally excellent medical communicators. Your clinical background gives you a level of credibility that most writers just don't have. Our fourth option is becoming a telehealth nurse. This is a great path for nurses who love patient interaction, but without the physical toll. Telehealth exploded during the pandemic, and it's still one of the most stable, low-stress nursing roles available today. Your role would include things like phone or video triage, chronic care follow-ups, health coaching, and patient education. The stress level is low. There is zero physical strain, a predictable workflow, and a home-based environment. Salary potential is usually between $65,000 and $95,000 a year, and some roles even pay hourly with bonuses. From a psychological standpoint, you can build great rapport with patients without the surrounding chaos of a unit. This reduces sensory overload and the fatigue that comes from constant multitasking. Finally, let's talk about becoming a legal nurse consultant. This role offers high income potential and structured work that fully utilizes your clinical judgment. As a legal nurse consultant, you'd work with lawyers, insurance companies, or hospitals to analyze medical records and identify key issues in cases. These might include malpractice, personal injury, workers' compensation, elder abuse, or med-surg complications. The stress level is moderate to low. It's analytical work with a case-by-case review and no direct patient care. The salary potential is where this role really shines, ranging from $90,000 to over $180,000 a year. Some experienced consultants charge between $150 and $250 per hour. This path offers high intellectual stimulation with no physical exhaustion and often a flexible schedule. Nurses over 40 excel here because this job rewards deep clinical experience, not physical stamina. So here's the truth. You don't have to stay at the bedside to remain a nurse. Your skills are valuable. Your mind is valuable. Your experience is valuable. If you're thinking about transitioning into a low-stress healthcare role, tell me in the comments which of these 5 careers you want me to break down next. And if you want deeper videos on burnout psychology, career transitions, or mental health, hit subscribe so you don't miss the next upload. Thanks for watching.